Hello, I'm Jubilee Milan Berazon, and for today's video, we're going to perform two procedures, the Heimlich maneuver and the newborn resuscitation. So without further ado, let's get started. First in the list, we need to verify if the newborn is choking by checking to see if the newborn is crying or coughing forcefully. Allow the newborn to keep coughing and be prepared to give the first aid for choking if the newborn's condition changes. Next, I position the newborn. I place my forearm along the newborn's back, cradling back of the newborn's head with my hand. I place my other forearm along the newborn's front, supporting the newborn's jaw with my thumb and fingers. After that, I turn the newborn over so that she is face down along my forearm. I give 5 back blows as I firmly strike the newborn between the shoulder blades with the heel of my hand. I keep my fingers up to avoid hitting the newborn's head and neck. Then, I reposition the newborn. I place my hand along the newborn's back, cradling the back of the newborn with my hand, while my thumb and fingers supporting the jaw and my forearms to support her as I turn her over to face up along with my forearm. I lower my arm onto the other thigh so that the newborn's head is lower than her chest. I give 5 chest thrusts by placing the pads of my 2 fingers in the center of the newborn's chest on the breastbone just below the nipple line. I press down about 1 1/2 inches and then let the chest return to its normal position. I always support the newborn's head, neck, and back while going back blows and chest thrusts. I continuously give 5 sets of back blows and 5 sets of chest thrusts alternately until the newborn can cough forcefully, cry, and can breathe normally. However, I also learned that if the newborn becomes unresponsive, I should lower her to a firm flat surface and begin CPR. We will tackle this on the next procedure, so I will no longer elaborate it. Lastly, perform hand hygiene and document the procedure in the patient's chart if you are in the hospital setting. Okay, so now we are going to perform newborn resuscitation. First procedure, check the newborn if unresponsive and if not breathing. Tap the bottom of her foot and shout while checking the normal breathing. If the newborn does not respond and is not breathing or only gasping, start CPR. Place the newborn on a firm, flat surface on a supine position and stand beside the newborn. Place one hand on the newborn's forehead. Then place the pads of 2 fingers on the center of the newborn's chest just below the nipple line. Start giving compression by using the pads of your fingers at about 1 1/2 inches. Push hard and push fast with the rate of 100 to 120 compression per minute. Now we're going to give 2 rescue breaths. If available, place a breathing barrier over the newborn's nose and mouth. Open the airway by putting 1 hand on the forehead and 2 fingers on the bony part of the chin, and tilt the head back to a neutral position. You can either use an ambu-bag that is attached to an oxygen tank and regulated, or your mouth to make a complete seal over the newborn's nose and mouth. For using our mouth, take a normal breath and blow into the newborn's nose and mouth for about 1 second. Then look, listen, and feel if the chest rises. For an ambu-bag, press 2 breaths and observe if the chest rises. If the first rescue breath does not cause the chest to rise, retilt the head to ensure that the airway is properly sealed before giving the second rescue breath. If the second rescue breath does not make the chest to rise, an object may be blocking the airway. After the next set of compression and before attempting rescue breaths, open the mouth and look for an object. If seen, remove it using a finger sweep. Continue to check the newborn's mouth for an object after each set of compression until the rescue breaths go in. Continue 30 compression and 2 rescue breaths until the newborn is revived. Lastly, perform hand hygiene and document the procedure in the patient's chart if you are in the hospital setting. Thank you for watching.